Hey there, viewers! Sometimes we women tend to ignore the signals our bodies are sending us. Many of these symptoms can be serious. We'll nip that problem right in its formative stage. Prevention is certainly better than a cure. Let's get started with these 7 disease symptoms that women can't ignore. From frequent urination to fatigue to sudden weight loss, we're talking all that and more. Number 1. Frequent urination. Have you been rushing to the bathroom rather frequently? Do you constantly experience the urge to pee? Pregnancy can be the exception to this. Many pregnant women experience urine leakage, especially when laughing, sneezing, or coughing. This happens due to the pressure put on your bladder, urethra, and pelvic floor muscles by the growing baby. However, if you're not pregnant and still experiencing frequent urination or loss of bladder control, it could be a sign of a problem with the kidney, urinary tract infection, or hormonal imbalance. Frequent urination accompanied by thirst can also be a sign of diabetes. But here's a catch. How would you know if your visits to the bathroom are too often? As a rule of thumb, it's normal to urinate 4 to 10 times a day. But if you're going more than 10 times a day, it might be time to visit a doctor. Number 2. Hair where there shouldn't be. Before you start panicking, understand that it's normal to have body hair. As women, we tend to dislike hair growth anywhere except the head. If you've been experiencing a sudden growth in body and facial hair, it might be time to consult someone. Excessive body hair means that your body has more male hormones than it needs. It poses not just cosmetic concerns, but medical threats like metabolism disorder, infertility, endometriosis, and breast cancer. One study found that women who have excessive body hair may be at a greater risk of developing breast cancer. The level of the male sex hormone androgen was associated with both excessive body hair and the risk of developing breast cancer. Another culprit for excessive body and facial hair is polycystic ovary syndrome. This is a common hormonal disorder experienced by women within reproductive age. If you're experiencing adult acne, irregular periods, obesity, or high blood pressure along with unwanted hair growth, it could be PCOS. Number 3. Chronic stomach troubles. Occasional stomach problems aren't that big of a concern unless you start experiencing constipation, diarrhea, indigestion, abdominal pain, or bloating on a daily basis. Chronic stomach problems often indicate an underlying disease like gluten intolerance, celiac disease, or irritable bowel syndrome. IBS syndromes include frequent constipation or diarrhea, abdominal cramps, or alternating constipation and diarrhea. Studies have revealed IBS is more common in women than men. IBS is often confused as an upset stomach, but if you consult a doctor, it is a treatable condition. You might experience relief from IBS by making certain lifestyle changes along with medication. For frequent stomach problems, you should consult a doctor as soon as possible. Number 4. Dizziness and shortness of breath. It's okay to feel dizzy once in a while. It could be due to excessive tiredness, long hours between meals, or just climbing a flight of stairs. However, if you find yourself gasping for breath even after a light activity, something could be affecting your heart and lungs. Frequent shortness of breath after normal, day-to-day activities needs to be brought to your doctor's attention. One of the underlying problems could be coronary ischemia. This is caused by insufficient blood flow to the heart muscles. It can be due to complete or partial arterial blockage. If left untreated, it can cause a heart attack and prove fatal. If you experience chest pain, lightheadedness, nausea, or dizziness, along with shortness of breath, you need to go to the emergency room. Before we move on, here's a video discussing 17 best anti-aging foods every woman should eat. Number 5. Unexplained weight loss. Weight loss is only good news when you're trying to shed it. Unexplained weight loss is anything but pleasant. It could signal Crohn's disease, type 2 diabetes, thyroid disease, gluten intolerance, HIV, cancer, or heart problems. The trick to identifying the severity of your weight loss is to pay close attention to your weight. Losing 10 to 15 pounds over a span of a few months without any significant changes in diet or lifestyle could be a concern. Talk to your doctor the first chance you get. Number 6. Black stool. Yeah, we get it. No one wants to look at their business before flushing it down. But as disgusting as it sounds, you should take a look once in a while. The color of your stool says a lot about your health and can sometimes indicate conditions like cancer. A healthy bowel movement is characterized by a no-strain, painless passage. While most people experience bowel movements once a day, it's okay to go 3 times daily, or even every other day. Black stool is a symptom that should never be ignored. Traces of blood or maroon-colored stool suggests bleeding in the lower GI tract. Bleeding in the GI tract can be caused by ulcers, diverticulitis, cancer, hemorrhoids, inflammatory bowel disease, and other GI conditions. It should also be noted certain diarrhea medications and iron supplements can cause black stool. Number 7. Feeling tired all the time. Juggling between home and office can certainly make you feel tired. But when you've been tired for quite a while, it needs to be taken seriously. Bouts of fatigue are different from chronic fatigue. Temporary tiredness can be caused by an erratic sleep schedule or a hectic day at work. It's usually manageable with simple lifestyle changes like eating a healthy diet, exercising, yoga, meditation, and sleeping for 7 to 8 hours a night. But if you're feeling tired constantly, even upon waking up from a restful sleep, it could be a sign of chronic fatigue syndrome, depression, anemia, cancer, liver failure, thyroid disease, cardiovascular disease, kidney failure, diabetes, or sleep apnea. Do you keep track of your health? Have you experienced any of these symptoms? Let us know in the comments below. We would love to hear from you. Enjoyed this video? Hit like, share, and subscribe to Bestie. Wait, what kind of bestie are we if we don't tell you about our other awesome videos? Go ahead, choose the left or right video, and enjoy.